I'm Dr. John Tomasoff, again with Dr. George Chapman, the pioneer, and we're just following through the series on what the FDA has approved. And one of the things, of course, the primary functions that we use thermography for is breast thermography. And we're going to be discussing a comparison between what we see in terms of a cancer and also some things that we don't see as a cancer, but a lot of fibrocystic, cystic type of disease with the thermography. So Dr. Chapman, here we have a malignancy.
Right, we can clearly see the malignancy on the right breast. This is also negative on the mammogram, but we see it very clearly early on the thermogram. There's no reason for patients to wait, and the mammogram doesn't show up the malignancy for about 5 years, whereas thermography frequently will show the malignancy due to the thermoregulatory dysfunction, and that shows up within the first 1 to 2 years, giving you a lot longer time and sooner time for repair.
Well, one big factor I know in just the American Cancer Society came out with a statistic that said 95% of cancers, if found early, could have a higher cure rate. So that's really important. The earlier the detection, we know the higher the cure rate.
It would be great. And besides, thermography can monitor the effectiveness of the treatment, no matter what type of treatment you may decide to follow.
Okay, we're going to look at now, because number one, we can find it early, but also maybe we're not finding breast cancer, but we're finding something else. And in this slide here, we're looking at cystic fibrocystic breast. And what do you see when you look at this film compared to the last one, Dr. Chapman?
Well, we don't have the different color, the redness and the yellows and so forth. What we're seeing is little circular areas of cold in both breasts. That's regional hypothermia, and that would be characteristic of cystic or fibrocystic breasts. And we can also then use the thermogram to monitor their treatment as well. We can also see hormone changes early, and you can monitor it with thermography as well.
When you look at hormone changes, I know a lot of times what we're looking at is just the vascular pattern right across the breast, upper part of the breast there.
Yes, it's very clear.
Yes. And one thing that we know is, again, it's nice to know whether you got breast cancer, you found out if you had it early, but two, to know that probability is you don't have breast cancer. You know, that the signs are there.
That's right. When you have cystic or fibrocystic breast, your breasts have a tendency to ache. There's a degree of pain in the area. Cold has a tendency to aggravate the region. None of those are signs of cancer. That's something you would just pick up with cystic or fibrocystic breast.
And a lot of times they'll come in with a lump or something, they'll want it diagnosed, and we see a cold spot around that area. Probability is pretty
It would
high.
also be cystic or fibrocystic, benign. Yes.
That concludes today. Thank you for joining us.